Hi, I'm Fiona Armstrong. I'm the founder and Strategic Projects Director at Climate and Health Alliance. So I'm reporting back from the Better Healthier Futures Roundtable that was held yesterday and the health sessions that we had today. So there's a clear message from health groups who've been participating. Climate change is affecting the health of Australians right now, and it's costing lives. It's also having a profound impact on our mental health. That's why health groups have welcomed the federal government's commitment to develop a national strategy on climate health and wellbeing for Australia. We'd also like to acknowledge Dr. Sophie Scomps, the independent member for Mackellar, who has been championing this issue in the Parliament. We know that good climate policy is good public health policy. Decisive and ambitious climate action will save lives and make us all healthier. That's why health leaders and experts who've been participating in the Better Futures Forum and those from different sectors have worked together to develop a guidance called Healthy, Regenerative and Just to guide Australian government, business, communities and the healthcare sector on how to respond. What's been produced is a comprehensive climate plan, not just for the health sector. It calls for Indigenous cultural knowledge and practice to be at the heart of decision making on climate change and health. Among the recommendations that we are calling on the government to prioritise are for a cross-portfolio ministerial forum to ensure coordination across portfolios, to undertake a national climate and health vulnerability assessment so that we know where people are being affected by climate change the most. We want an evaluation of the economic value of the health benefits of carefully designed climate strategies. We need to see a sustainable healthcare unit established in the Commonwealth Department of Health to drive change towards environmentally sustainable and low carbon operations. We're very encouraged by the response by the Minister for Health, Mark Butler, and the department. There's clearly a commitment to deliver a positive outcome on this. We're delighted that the Minister for Health is someone who has also been the Shadow Minister for Health and Shadow Minister for Climate Change, who understands this intersection. We're also very heartened by the engagement of the states and territories, and we're thrilled to hear that there's unanimous support from state and territory health ministers to work with the Federal Health Minister to develop a national strategy on climate health and wellbeing for Australia. So collaboration has been a very strong theme that's come through from the events at Better Futures Forum and the Roundtable yesterday. We know in the healthcare sector that we need to focus on the whole person. And in tackling climate change, we must also take a systems approach. We feel like we're on the cusp of some very positive change, particularly if we work together, government, NGOs, business, universities, and of course with First Nations people.